Hello, welcome to Aasaan ERP. In this tutorial, I'm going to give you a brief about the healthcare management system that is there in Aasaan ERP. So, to begin with, first the question is, why do we need the healthcare management system? To answer that, let us consider the example of a busy hospital. In a busy hospital, a smart computer system helps doctors and nurses take care of patients better. It keeps track of all the important information about patients like their medical history and appointments. The system also helps with things like making appointments and dealing with insurance. It's like a helpful assistant that lets healthcare workers focus on helping people feel better. And it's really good at keeping patients' information safe and following the rules. With this system, hospitals can learn from data to do even a better job. Plus, patients can use it to do things like book appointments online. This computer system isn't just a tool, it's like the heart of a big change in how healthcare works, making things easier and better for everyone. So, let's assume that we have a clinic named Excel Clinic which currently runs the daily operation manually. A lot of patient comes in for consultation, laboratory tests, and functioning, and surgeries are also taking place simultaneously. All of this data needs to be captured systematically to ensure smooth functioning of the clinic. Let's see how Asan ERP will help us streamline the whole process. So in Asan ERP, for each unit or department in the healthcare facility, we can create a medical department. We can navigate to the medical department from the healthcare menu that we have, then go into masters and we'll find the medical department module there. Here we can view all the predefined medical departments and also we can create new ones. To create new record, we simply have to create on the green plus button that is present in the system and we'll just write the name of the department. Let us consider cardio. So this way the medical department is added into the system. So if we click on list, we'll be able to see all the medical department that has been added into the system. In Asaan ERP, we can map our facility infrastructure and manage appointment scheduling, billing, etc. by creating a service unit. As a prerequisite, we will have to create a healthcare service unit type. So to create a service unit type, we will come into the facility management and over there we will find healthcare service unit tab. Over here, we will click on the create page and after that we can write the name of the service unit type that we want to add, like for example, OPD rooms. Then we can have this checkbox check if it allows us to take appointments, and also we can check on the allow overlap checkbox if it allows us to take multiple appointments at the same time. Also, we have the inpatient occupancy checkbox. When we select the inpatient occupancy checkbox, if the service unit type represents a facility like an operation theater or a ward that allows occupancy of patients. If we click on it, we further have a is billable checkbox. So if the usage of the service unit type needs to be billed separately, we will select the is billable checkbox. Once the healthcare service unit type has been created, now we can move on to create the healthcare service unit in the system. We can navigate to the healthcare service unit from the menu. Under the facility management, we have the healthcare service unit, and on going to that module, when we create, we'll get the form to create a new healthcare service unit. Let us consider we are naming the service unit as physiotherapy. So if we want to group some other service unit inside this service unit, then we can use the is group checkbox. Otherwise, if it is a direct service unit, we can uncheck this checkbox. And then we can define under which service unit type it comes, which company it belongs to, company as in the name of the hospital, which we named as Excel Clinic. And upon selecting the service unit type, the allow appointments, inpatient occupancy, is billing will be fetched automatically according to the service unit type. We will select the warehouse if the type is linked to an item like pharmacy. Also, we can add the parent service unit if it is applicable. Once the healthcare service units are defined, next we'll move on to the healthcare practitioner module. In the healthcare practitioner module, we'll create various healthcare practitioners who are basically the doctors, nurses, lab technicians, etc., who are serving the hospital unit. So to create one, we'll click on Add, and in here we will enter the basic details of the healthcare practitioner, such as his name, contact details, his gender, etc. Upon completing the basic details, we will next move on to the employee and user detail. So we also have the HR module. So in the HR module, we have the employee created. We can link this health practitioner to the employee. If that health practitioner is having a user account in the ERP system, we can connect him with the user account which is already created in the system, which medical department he works in, and the name of the hospital. After that, we have these appointments under which service unit he is working, what is his schedule. Next, what are his charges, and the account details. Once the healthcare practitioners are added into the system, next we will proceed to create the practitioner schedules. A healthcare schedule will help us configure the availability of the healthcare practitioners. We will find the practitioner schedule under the master's menu. Here we will get to see all the practitioner schedules which are already created into the system. Otherwise, if we want to create a new, we'll click on the add button. First, we'll give a name to the schedule. Let us consider Team 1 schedule. And after naming the schedule, we will proceed to create the time slots for each day of the week. So let us consider first, we are considering Monday. So from which time on Monday to which time the schedule is applicable. Next, we will keep on adding all the days of the week, from which time to which time. And this way, once all the necessary details regarding the schedule is done, we will click on submit and save the practitioner schedule. Next, we need to set up into the system our medical code standard and medical codes. Medical coding is required in many countries for regulatory compliances, and many medical insurance companies manage eligibility and coverage based on the medical code standards. We can explore the medical code standards under the facility management menu, and here we will see all the medical standard codes which are already created. If we wish to create any new medical code standard, we can simply click on the add button and we can create the medical code here and click on the submit button. After that, we will navigate to the medical code page, and medical code which are already created will be shown up in the table. And if we wish to create, we can click on the add button and we can add the medical codes. So under which medical code standard it belongs, what is the code, and if there is any description, we will enter it over here. At the last stage of the healthcare management system setup, we also have the healthcare settings where we can configure the healthcare management system with some default values and default operations. Like here, collect fees for patient registration. Checking this will create new patients with a disabled status by default and will only be enabled after invoicing the registration fees. All these settings can be configured under the healthcare settings module. Once the setup is done, now we'll proceed to the patient management. To make it easier for the patients to schedule an appointment, it will greatly enhance the relationship with the healthcare provider. Offering a user friendly online tool allows patients to book, reschedule, or cancel appointments effortlessly. Once a patient is enrolled in the system, future visits become seamless as staff can access their information easily. This aids in developing comprehensive patient histories beneficial for both patients and the healthcare providers. Sending appointment reminders, lab results, etc. via SMS or email ensures patients have timely access to crucial information. Moreover, automating tasks like billing elevates the burden on busy staff. Gathering details such as medical history, allergies, and risk factors assists doctor in making informed clinical decisions. In some jurisdictions, this data collection may even have legal implications. Let's explore patient management in action using Aasaan ERP. A patient corresponds to any individual who is a recipient of the healthcare services we provide. Suppose a new patient has visited the healthcare organization. We will collect the information by navigating to the patient module under the masters. Here we will get the list of all the patients which has been registered into the system. Otherwise, if it is a new patient, we'll click on the add new button and we will create the patient in the system. First, we will enter the personal details of the patient like name, gender, blood group, and date of birth. The status field will automatically be set to active. We can also create a unique identification number or input the unit identification number if it exists, and also set the preferred mode in which the patient would like to receive their report. It could be either by email or a hard copy. Then we will enter the patient's mobile number. This is important if we have enabled SMS alert for the patients. Enter the email address of the patient and click on the invite as user checkbox if you want the patient to have access to the patient portal. Further, we can also capture additional patient details like marital status, the relationship with another patient. We also have provisions to capture the medical history like allergies, medical history, medications, and surgical history. Moreover, if the patient has or had any addictions, we can capture those details here. Apart from that, if there are any other occupational hazards the patient is exposed to, those details can be mentioned here. If any additional risk factors are there, those can be written here as well. Lastly, any additional information that needs to be added can be entered here. Once done, we can save the document. In this video, we will be discussing consultation management in Aasaan ERP. By the end of this video, you will know creating patient encounter records, recording vital signs, recording symptoms and diagnosis, treatment plans, and clinical procedures. Patients and healthcare practitioners encounter is the most important activity of healthcare providers. This consulting needs to be set up by making sure all the relevant information is made available to both parties, providing a consolidated view of the daily schedule of the patient encounters will help practitioners to prepare for the day. Scheduling the usage of service units like consultation and nursing rooms improves both patient and practitioner experience. Vital signs of a patient needs to be recorded as this will help practitioners assess the patient's condition. The symptoms and the diagnosis needs to be recorded. Further, the treatment plans, clinical procedures, and lab tests recommended need to be communicated to the relevant parties. Let's see consultation management in action in Aasaan ERP. Let us consider a patient has an illness and registered into the system. The practitioner will now consult him with a further course of action. It is quite possible that some lab tests may be required, or if it is a crucial or critical diagnosis, the patient will have to be admitted to the hospital. All this will depend on what the consultation is recommended. In Aasaan ERP, we can streamline this entire process. Let's see how it can be done. To begin with, we will start with appointment type. Appointment type allows us to predefine the duration of the appointment, specify whether it is inpatient, and set colors to differentiate between different appointment types for analysis. Let's navigate to the appointment type list first. So here we will have all the predefined appointment types which has been already added into the system, and if we would like to create a new one, we'll click on the add new button. First, we will enter the name of the appointment type. Then we'll select the inpatient checkbox, and if it is ticked, the appointments created under this type will be used for inpatient department care. Set the default duration and choose a color for each appointment time. Moving forward, let's add billing details. We need to select the appropriate price list, then click on Add Row and select the medical department. We will then select the outpatient consulting charge item and the inpatient visit charge item, which will fetch the charges based on the price list selected. Once we have all we have added all the details, we can click on Save and proceed further. When a patient wants to consult a practitioner, it is necessary to book a prior appointment since it helps manage the patient as well as the practitioner's time efficiency. In order to create a patient appointment manually in our healthcare system, we can use the following steps. We'll go to patient appointment under the consultation menu, and here we will get the list of all the appointments which has been already created. To create a new one, we'll click on the plus icon. Here we will select the patient, and after selecting the patient, we will select the patient wants to consult which health practitioner, and after that, which department he wants to consult. After that, we will select the appointment type. The duration will be fetched automatically from the appointment type. Then we will select the clinical procedure template and the therapy plan if they are applicable. Then we will enter further details such as payment information, and if other health practitioner has referred the patient to the current practitioner, we will add him up here. And if there is any other remarks to be made, we will note it down here and we will proceed and save the appointment. A clinical procedure is any practice of a health practitioner that involves the combination of special skills or abilities and may require medicines, devices, or both. We can create templates so that you don't have to enter the consumable rates and linked items every time we create a clinical procedure for a patient. So to create a clinical procedure template, first we will go to consultation setup. Under there, we will find clinical procedure template and we'll click on the create button and we'll get this document and we can add the template as per the requirement. Now that we have created a clinical procedure template, we can create a separate clinical procedure manually. Let's navigate to the clinical procedure list from the menu. It will be available under consultation clinical procedure, and we will get the list of the clinical procedures which are already created. If you wish to create a new one, we'll click on the plus icon and we will proceed to create a new one. Select the procedure template. The warehouse, medical departments, and the consumables will be fetched automatically from the template. If we have created an appointment for the clinical procedure, we can select the appointment. It will fetch the procedure template, patient start date and time, etc. Enter or edit details of consumables in the consumable section. Select the service unit if it is not set, and the procedure will be conducted in that unit. If some samples will be collected during or after the clinical procedure, create a sample collection document and link it. And finally, save and submit. The vital signs of a patient needs to be recorded, and this will help the healthcare practitioners assess the patient's condition. So to record the vital signs in the system, we'll go on the consultation and over there we will find the vital signs. So to create a new vital sign, we'll click on the add button and here we'll select the patient and the time. Next, we can enter details of the vital signs like body temperature, heart rate, or a pulse, respiratory rate, and blood pressure. Further, the observations on the tongue, abdomen, and reflexes can also be entered. Additional observations can also be entered in notes. The details of the height and the weight of the patient can be entered in the nutritional value section. Once the height and the weight is entered, the BMI will be calculated automatically. A patient encounter means professional contact between a practitioner and a patient, whether an admission, consultation, diagnostic, operative, or invasive procedure at the hospital. Since this is a very important interaction, we need to record every encounter with patients through the patient encounter module. Let's see how we can create a patient encounter record. We can navigate to the healthcare domain and click on the patient encounter under the consultation menu. Here we will get a list of all the patient encounters. To create a new patient encounter, we'll click on the add button, and upon clicking the add button, we'll get the document to fill up all the details regarding the new patient encounter. Here we will first select the patient, the healthcare practitioner, and enter the encounter date and encounter time. If the patient has booked an appointment, the same can be selected. Next, enter the symptoms and the diagnosis. Once the diagnosis is done, the medical core of the condition observed can be entered. Next, the detail of the drugs prescribed along with the dosage period and the dosage form can be entered in the medication section. If any lab tests are recommended, the details of the same can be captured in the investigation section. The details of the clinical procedure recommended can be captured in the procedure section. Lastly, if any therapy are being recommended, the details of the same can be captured in the rehabilitation section. Once the patient has had an encounter with the practitioner, based on the diagnosis, the lab test therapies, procedures, or the medications will be prescribed depending upon the patient's medical condition. Many times, the treatment prescribed is the same for many patients, and adding data entry becomes a repetitive task and the doctor's time is consumed. Instead, we have an option to pre-configure this frequently used item in a template called as treatment plan template. During the patient encounters, all these items can be filled automatically and can be updated on the fly if required. Let's see how we can create a treatment template plan. Firstly, we will navigate to the consultation setup menu and there we will find the treatment plan template. Over here, we will get all list of all the templates which has already been created, and we can also create new templates as required. First, let's give this template a name and add a medical department where this plan will be frequently used. A set of conditions like complaints, diagnosis, gender, and patient age range can be set on each plan template. This will help us in filtering care plans for the patient encounters. Next, we will see the plan item section. Here, the therapy type, clinical procedure template, and lab test templates items can be configured. When applying a treatment plan template from the patient encounter, these items can be filled automatically. Lastly, a set of drugs along with the dosage, duration, and form can be configured here. After filling up all the required details, we can click on Save. And we can use this template once created in patient encounter so that the healthcare practitioner does not have to enter all the repetitive details again and again for different patients. Welcome to Aasaan ERP. Today we will be discussing lab management using Aasaan ERP. By the end of this video, you will know creating lab templates, setting up item master, sample collection, invoicing, and lab reports. Labs play a critical role in the diagnosis and treatment of patients. Upon patient encounter, healthcare practitioners may recommend lab tests to assess the patient's conditions correctly. If the lab facility is available with the healthcare provider, this information needs to be communicated to lab technicians along with patients. Technicians collect the sample as per specifications and conduct the test to come up with the results, which are then communicated to healthcare practitioners and patients. Asan ERP provides features to automate this via email and SMS alerts so that patients can proceed with booking further appointments. Asan ERP allows lab test templates to be created so that the technicians adhere to the processes and the standards defined. Lab test template allows us to create all types of lab tests rapidly. We can pre-configure the events and results for varied tests so that we don't have to fill in redundant data every single time. Let's create a lab test template. To do that, we will go under the laboratory setup menu and there we will find lab test template. We will find all the templates which are already created in the system, and if you wish to create a new one, we can click on the add button. Over here, we will specify the name of the lab test. Items are created automatically on template creation for managing the billing workflow of lab tests. A default item code will be generated which we can change if required. We can also use existing items which has been already created instead. Select the medical department for which the lab test is conducted. We can disable the templates when they are not being used by clicking on the disable button. Here we will have to specify the result format for the lab test, which are single, compound, descriptive, grouped, imaging, or some tests might not have some result. Once the lab test template is configured, we will submit it and proceed to creating lab tests. To create a new lab test, we'll go to the laboratory menu and here we will get the lab test. Upon going into the lab test, we will get the list of all the lab tests which has been performed and we can also create a new one. So we'll click on the add button to create a new lab test. Here we will select the template if the template has already been created, and hence the fields which are defined in the template will be fetched automatically. We can select the practitioner and the lab technician here. Once we click on save, all the data configured in the template will be fetched and set in the lab test document. As the report gets ready, we will enter the details of the results in the lab test document. Once submitted, we can send an SMS or email to the patient and share the results. Let's navigate to the sample collection module. So we will find that module under laboratory sample collection. We'll create a new sample collection and here we will select the patient. Once we select the patient, here we will select the sample. So the lab test samples can be created in the laboratory setup. So here we have lab test sample. So let's proceed to that one first. So here we can create various type of samples the laboratory takes in. Let us consider blood. And what is the unit of measurement. So the unit of measurements can vary from different samples, so that can be created in the lab test unit of measurement module. So here we have done, for example, cells per CUMM, and we'll add the lab test sample. So we'll come back to laboratory sample collection, and here we will select the sample, and we will select the other details such as who has collected it, which user, then what is the quantity, and what are the number of prints of report required when it was collected on, and what are the collection details. And this way we can manage all the samples which are being collected by the laboratory. Welcome everybody. Today we will be discussing inpatient management using Aasaan ERP. By the end of this video, you will know managing patients, admission, managing. Welcome everybody. Today we will be discussing inpatient management using Aasaan ERP. By the end of this video, you will know managing patient admission, managing inpatient treatment, managing inpatient medications, and discharge. Healthcare practitioners will assess the severity of symptoms and condition during the patient encounter and determine if hospitalization is required. Some patients are asked to admit to the hospital so that the treatment is provided by trained professionals. The admission, treatment, and discharge cycle generates a lot of data that needs to be captured and maintained. Aasaan ERP will show the availability status of healthcare using like beds, operation theater, and intensive care unit. During the treatment, healthcare practitioners routinely check patients and determine medications to be administered and further lab tests to be done. Also, it is important that all healthcare services provided to the patient are billed before the discharge. Aasaan ERP makes it easy to automatically send follow-ups after the discharge via SMS and email alerts. Let's see inpatient management in action in Aasaan ERP. For the admission of a patient, we need to create an inpatient record. We can navigate to the inpatient record under the inpatient menu, that is under the healthcare domain. Here we can create a new record by clicking on the add button. First, select the name of the patient. This will automatically populate the basic details regarding the patient. The admission status, the date and time needs to be selected. Next, select the medical department that will be overlooking the patient, the admission service unit type, the primary healthcare practitioner, and the secondary healthcare practitioner if applicable, as well as if there is any notes that can be written down over here. Moving on, we can even add nursing tasks that will be applicable while the patient is being treated, along with the expected number of days that the patient will be admitted. As part of the admission order, the practitioner can provide necessary details as to which type of ward the what bed the patient needs to be admitted to, and other admission instructions for the staff on ordering a patient for admission. The Asan ERP Healthcare creates an inpatient record for the patient with all the instructions provided by the practitioner. Here we can enter what are the complaints from the patient, what are the diagnoses, what are the medications required, what are the investigations to be done, what are the procedures to be followed, and what are the therapy or the rehabilitation required for the patient. Once a patient is admitted to the hospital, some medications need to be provided according to the prescribed schedule. An inpatient medication order is created to prescribe the medications like the drug, the doses, etc. Let's navigate to the inpatient medication order, which is available under the inpatient menu. Click on inpatient medication order and select the patient. Here we can select the healthcare practitioner, set the start date of the order. The schedule for the prescribed drugs will be created starting from the date. In the medication orders table, there we will click the add button, and here we will enter the details of all the drugs, the dosage, what is the dosage form, from which period to what period, and with all the instructions, the details will be added. Order entries are marked as completed when an inpatient medication entry is created against that medication order. It can be done from the inpatient medication entry module present in the system. Finally, when the patient has defeated the disease and is ready for discharge, a practitioner can order an inpatient discharge through a patient encounter or the inpatient record. The discharge order allows us to select the content of the discharge notes, which will get updated in the patient's inpatient record document. We can select the investigations, medications, and procedures included in the patient's treatment at the facility, which is to be given as the discharge notes to the patients in print. Further in the ERP, we can also track the data and manage the data of various tasks performed by the nurses in the healthcare unit. So, to track and record the nursing task, we have this nursing module under the healthcare domain. Over here, we can create nursing checklist templates where we can predefine the activities that will be performed by specific nurses to treat a patient. Here we will give a title to the template, then under which medical department it comes under, then what are the activities to be performed, is it a mandatory task, what is the type of task, is it pre-operation or post-op, what is the time of set, the task duration, and against which document. So once the nursing checklist template is created, now the nurses can log in into the system and create records against each task they perform daily. So they will choose like the date they have performed the task, who is the user or the nurse which who has an account created in the ERP, under which service unit they were exercising the nursing task, under which medical department, and what is the status. Here they can select which healthcare activity they have done. Was it a mandatory one? Then who's who was the patient under which they have performed the task, and all the task schedule and the task resolution details they can enter in the nursing task. Welcome everyone. Here we will be discussing rehabilitation and physiotherapy in our healthcare management system. By the end of this video, you will know what is rehabilitation, how can we plan therapy, and how can we manage exercises in Aasaan ERP. So, to start with, let us consider a patient has been discharged. In order to regain energy and make himself strong, both mentally and physically, there are a set of activities that will be prescribed to him. That is where the rehabilitation and physiotherapy operations will commence. We shall go ahead and see how we can streamline these activities in the ERP by setting up various operations. Firstly, let us create some exercise types so that we can classify the exercises based on the difficulty level, body parts for which it will be prescribed, and the steps involved in the same. Let us begin by creating a new exercise type. Here we will give the name of the exercise, what is the difficulty level. We can define the difficulty level and the body parts in the masters. Then what is the description of that exercise type. Then if we have any visual, video or any documents against that exercise tab, we can attach them here. Then after that, in this table we can add various steps involved in that exercise, like the first step, what to do. Then what is the description. For the first step, if we have different documents like video or any image, we can attach it here and we can add multiple steps against that exercise. Okay. So, as a therapist, we may prescribe a number of different therapies for a patient. Every therapist might have a set of exercises. Aasaan ERP helps us templatize the therapies using the therapy type. With this, we can create and link therapies to healthcare service units, add standard rates and item details for billing. We can also add exercise according to the body parts. Let us see how to create a new therapy type. First, we will enter the name of the therapy type. Here, we will enter the default duration in minutes, under which service unit it will fall under. Is it billable? What is the medical department? Do any nursing tasks needs to be involved in this therapy type? What are the item details as described sometimes back? What is the medical coding? What is the therapy is for? What are the exercises involved? Everything can be defined in the therapy type. A therapy plan lists all the therapies required for the patient along with the number of sessions. It also keeps track of the progress as per the number of sessions completed. Let's create a therapy plan by adding the add new therapy plan. Here we will select the patient, then the status and the start date of the therapy plan. After that, we will select a therapy plan template if it is applicable. Otherwise, manually, we will be inputting what therapy type it is there, what is the number of sessions required, how many sessions are completed. We'll keep on updating once it is completed. Therapy plan templates are used by some healthcare facilities for prescribing therapy plans as a package. In such cases, the number of sessions to be conducted and the total cost is fixed. The therapy plan created using the template will not be billed for individual sessions but for a package as a whole. To create a new therapy plan template, we'll come under rehabilitation and physiotherapy, and here we will find a therapy plan template. Here to create a new one, we'll click on the add button. An item will be created for the therapy plan template as a whole for billing purposes. We can also use a existing item. In the therapy type section, select the types which is covered under the template. The rate is fetched from the therapy type document. Enter the number of sessions to be conducted for each therapy type. The amount is calculated as a product of number of sessions and the rate. Item price is created and updated for the linked item accordingly. The total sessions and the total amount is calculated and set in the fields respectively. Click on Save once completed. Therapy session helps the patient have a face-to-face interaction with the therapist, performed individually or in a group setting. It also helps us map the patient's progress by keeping track of the activities required for the patient to complete each exercise. To create the therapy session, we'll click on the Add button. If a patient appointment has been booked for the session, select the appointment. All the other details will be automatically fetched. If no appointment has been booked, select the patient, select the therapy type and the therapy plan for the patient. Once we have selected the therapy type, all the details of the template will be automatically fetched. Select the therapist in the healthcare practitioner field. We can select a start date and a time and save it. We can then increase the number of counts completed, and once a particular exercise has been completed, select the level of assistance required for that exercise. Let's submit the documents once finished. When a patient is in rehab, there will be a lot of sessions or evaluations taken to track their progress. These evaluations have certain parameters based on which the patient's progress will be evaluated. Different forms have different scales to rate progress. We can create all such patient assessment forms seamlessly in Aasaan ERP by creating patient assessment templates. To create a patient assessment template, we will name the template and we will select the various parameters required for assessment. Here we can select the parameters and we can also create parameters from the patient assessment parameter module. Here we can create various assessment parameters. So going back, we can give minimum scale and the maximum scale and what is the assessment description. And we'll create the patient assessment template. Once the template is created, we'll move on to patient assessment. Let's create one patient assessment. We have an option to select a therapy session, select the patient assessment template, and then we can start the assessment by selecting the score against each parameters. Once all the details are added, click on Save. The total score obtained will be calculated as the sum of all the individual parameters score obtained. We can also add time and comments while evaluating individual parameters in the assessment table. And at last, we can submit the form after all the details are added.